Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, Tony here. I just wanted to tell you about a new forward that I put in the Unicorn Pharmacist Jobs book that I'd just written. And I wanted to speak directly to those who are place-bound or time-bound. So someone who's place-bound has to work in a certain place. Someone who's time-bound has certain hours that they need to work, whether around spouse, jobs, or kids, other responsibilities. Anyway, if you want to update your Kindles, it will appear for you, and hopefully that's helpful. So, without further ado, let's get on to this episode about burnout.
Hello, and thank you for joining us today on the Pharmacy Leaders Podcast. My name is Shannon, and I'm here today with my colleague and friend, Christine Mason. This is part 4 of our series where we are discussing administrative residency programs, our personal career paths, as well as implications of research we are working on relating to burnout and workforce issues. And today in part 4, Christine will share her insights on burnout and workforce concerns in community-based pharmacy practice. And if you have interest in our career paths and administration residencies and health system pharmacies, feel free to touch on episodes 1 through 3. But yeah, very excited about episode 4 today, Christine. So, of course, we've talked about burnout and why it's important before, but what got you started and interested in choosing this topic for your research thesis this year?
Yeah, so I think that is definitely one of the hardest parts of getting into research is figuring out, what you're going to research in the first place. So I feel like a lot of things drove me to end up diving into burnout and seeing what that looks like in the community-based practice world. And so I know, historically I've worked in community-based practice and then kind of in previous research diving into some workforce issues about employee engagement and retention and starting to see how that impacts, the care that we're able to provide to patients in community pharmacy. And the deeper and deeper that I got into kind of understanding what all of these workforce issues look like, I kept getting drawn to burnout. We started to see it more and more in medical literature and starting to pop up in pharmacy literature. So kind of the convergence of, wanting to dive in and learn more about our workforce and community practice kind of drew me to burnout to say that, we don't really know what this looks like right now. There's not a lot of literature looking at it. So that kind of sparked my interest to see, what does this truly look like and how is it impacting the care that we're providing to patients?
That's a really good point, calling out that there is a good amount of literature in medicine, populations, nursing as well. But yeah, pharmacists, there's still that gap there, which we came to fill. And so with that gap and uncertainty, sometimes maybe there's hesitation of other stakeholders and pushing forward this work. So how did you go about getting this project approved?
Yeah, so with any research project, you start going through and understanding what the needs are of your practice and where the gaps are in literature. So, coming up with your topic, but then beyond that, you have to figure out, do the folks that, the site that you practice or the institution that you practice at, are they sold on the topic? Do they agree with you that there's this gap in literature and this need to really pursue that topic further? So I think that's a huge opportunity, for students that are looking to get involved in research or, future residents, current residents that are wanting to get involved in research is understanding who looks at this project and who can kind of help you be a champion of your project. So, for example, in residency, you have, residency preceptors, perhaps at your site or a university that you have like a research mentor or preceptor that helps you along with that. So understanding who specifically at your site. So it may be just your preceptor, or if you're in a larger organization, it may be, management, leadership, directors of pharmacy that want to take a peek at the project you're doing and how it's going to impact practice. So I know that was one thing that, I worked with my research team at the College of Pharmacy at Ohio State to really understand how the project would come to be and how are we actually going to approach this gap in literature. So working with my research preceptors. And then beyond that, you have to develop your protocol. So how do you plan to carry out your research and then get it approved by an IRB or an institutional review board to be sure that, the research oversight at your institution agrees, with the practice of your research before you go out into the field and make it happen.
Great examples of collaboration, all the things necessary to succeed, especially in a residency research project when there's so many other people involved. So it's making me very excited about this experience. And could you share how you implemented your project?
Yeah, so the survey, or I guess the research that I'm doing, is a survey-based project. So there's a lot of different types of research projects. It could be a survey, it could be looking at qualitative or quantitative outcomes. There's a lot of different types of research you can do. So for my project, I did a survey. So similar to, some of the research design that Shannon talked about in part 3 of our series, I also used the Moslock Burnout Inventory, or the MBI, which is kind of the gold standard for assessing burnout out in the medical community. And so using that survey to assess burnout in community-based practitioners. So we were fortunate to be able to get a listserv from our State Board of Pharmacy to be able to share this survey or share access to it with pharmacists that were licensed in our state. And so using kind of the survey methodology to share that survey out. And that is how we went and got our data, and something we were really excited about, to be able to reach such a large population. A lot of times, especially with residency research projects, we look very institution specific. And so this was kind of a unique opportunity to look at a larger population. So that was something that we were really excited about.
And so the listserv of all the Ohio pharmacists, that's huge and such a great opportunity. So that, parallels with probably having a lot of data on hand to sort through and conclude, or, deliver some conclusions with that. So how did you go through that process?
Yeah, so I think that is definitely something, when you're going through the research process, is working with, your research team, mentors, preceptors to, on the front end, think about what data is it that we want to collect, and then what are we going to do with that data. So we sent out our survey to over 20,000 people. And so we didn't get 20,000 responses, but that's a lot of people to send that out to. So understanding how you can use the data discretely, because that's going to make your data analysis a lot easier if you have discrete or quantitative data that you can kind of do statistics on. But then we also mirrored our kind of open-ended questions against Shannon's survey so that we could see what are the differences between the different types of settings. So are there different opportunities and stressors that are identified in health system pharmacy versus in community-based practice? And so qualitative data is a whole nother beast, where it's really hands-on. It's not number crunching. It's really understanding, what are the themes, and doing thematic analysis and seeing, what are people really out there talking about when they have this really open-ended, they can type whatever they want. So, on the front end, understanding what data is it you're going to get so that you can have a strategy for how to analyze it.
So that's excellent. Great work, of course, going through all of that. So once you gather those results, what are some of the key themes that you would want to share with our listeners, and also where you have shared those results already or up to come?
Yeah. So, I've talked a lot about kind of the research process in general, but I guess kind of, a taste of this project and the results that we have. So, we looked at burnout and, presence of burnout, as well as the stressors that exist around it in community-based practice. And I think one of the most exciting results was one that wasn't surprising to us, but it's good to have data to back it up. So if you guys remember from part 3, when Shannon talked about that Moslock Burnout Inventory, or the MBI, there's kind of the 3 different dimensions of burnout. So the emotional exhaustion, the depersonalization, as well as the personal accomplishment or lack thereof. And what we saw most in community-based practice was really a risk for emotional exhaustion. And I think when we kind of think back to what the day-to-day looks like of a community-based practitioner, that's not surprising. They're, day in and day out, patient after patient, interacting face-to-face with patients. And so I don't think that that's surprising when we reflect back on what we would expect, but it's nice to be able to have data to back up our hypotheses, because that's, what the point of research is at the end of the day, is really having data to back up what we think is happening. So that's something that we found that was really exciting. And then going through and looking at, general risk for burnout, folks that are experiencing burnout or at risk for experiencing burnout. And in the community-based setting, we see that it really is mirroring what we see in the medical literature with physicians and medical residents and nurses. So, that also is scary, but validating that we can see that, the stressors that are on pharmacists, specifically in community practice, are putting folks at high risk for burnout.
Excellent point. Yeah, having those comparisons and adding to the body of literature, and knowing that while we are able to identify who is at risk and what that means in terms of what dimension, like emotional exhaustion, like you mentioned. Well, we know like in our physician colleagues, what that leads to in terms of medical errors, self-harm, things that are just very serious. So obviously not exciting results, but exciting what we can do next steps with them. So where have you shared these, poster-wise podium presentations? What would you recommend for people who've done something similar of how to select that process?
Yeah, so I think figuring out what to do with your research once you have conducted it, where to share it. I think that's another really daunting part of research. First, you're trying to figure out a topic, and I think that's really daunting because you have endless opportunities that you could go with. So I think, that's a step that people can get overwhelmed with. But then I think figuring out where is the most appropriate place to share it can be also pretty overwhelming. And so, a lot of times in residency, they have specific conferences or research sessions where you can go to present podiums or posters. But then when you get to manuscript, that's a whole new ballgame because you have an endless opportunity of journals that you can publish that in. So definitely, again, working with your research team to understand where's the most appropriate place to share that research. Because if you're really thinking about who do I want to see these results, that'll help drive that. So I've presented a poster at the American Pharmacists Association as well as podiums at our state association at the Ohio Pharmacists Association, really thinking about, professional organizations that have a substantial amount of community-based practitioners, because that's the population that, I was really trying to reach with this work is community-based practitioners. So trying to be strategic in where I think that they would be. And then, obviously Shannon and I have been here on this podcast sharing some of this information with you. So again, we've been able to share some tips and tricks about residency and research in general, but also the opportunity to reach additional audiences through blogs, podcasts, commentaries, and things like that. So you can just kind of expand the reach of your work. So I think that is definitely another really exciting piece of the research process is figuring out, where to share your results to make sure that they're reaching the audience that you intended when you came up with your question in the first place.
Well, Christine, I feel like we shared a lot of good information with the listeners over the last 4 episodes. And so anything that comes to mind of maybe final takeaways, whether it's related to residency itself, burnout, or just good tidings to leave the listeners with?
Yeah, absolutely. So I think one general piece of advice that I always give students and fellow residents is really just the idea of saying yes. That's something that really resonates with me. And I genuinely feel that I wouldn't be here today, sharing this conversation with you if I hadn't said yes to opportunities years ago. So I think really saying yes to opportunities, because you never know what's going to open your eyes to things that interest you or help you figure out, what really is your passion and what do you want to do with your career. So that's something that I always share with students and fellow residents is just say yes. And then since we're talking about research today, just some research advice. I know a lot of students as well as residents, research is very overwhelming. It's different than what we learned, in pharmacy school. We learned about therapeutics and taking care of patients, not about writing IRB protocols. Mm-hmm. So I think research can be really daunting. So I would say for those of you that would like to pursue research, definitely find a mentor that can help walk you through the process. And that may be a formal mentor, you might be a preceptor, a faculty member, or it might be a fellow resident or a previous resident that can kind of walk you through their experiences. So the having a mentor in research and a mentor in general, I think is really meaningful to help you understand, where you are and where you want to go, because they can bring you a different perspective than you might have for yourself.
I would echo that. My takeaway message is going to be use your resources. So whether that's in the formal sense of a mentor and an actual human being who can embark some knowledge, or just the resources that are so abundant in our age of very advanced technology, there's so much that we can take advantage of. So lean into that discomfort of things that might feel a little scary and say yes, because you will amaze yourself with the potential that is within. So I think with that, we are going to bid our farewells, at least for now, of this 4-part series. Thank you for those who tuned in at least to this episode. Feel free to go back to listen to the other 3. Thank you to those who have listened to the other episodes as well. And we wish you the very best wherever you are in your career journey.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.